Hey, today I'm going to show you how I make treatment decisions in a brachycephalic dog. We see these dogs all the time for dental cleanings, and we tend to find a lot of disease and a lot of hidden disease. So come along with me as I walk you through one of my recent cases. So let's have a look here. I'm going to show you both the dental chart, the x-rays, and some clinical photos. And this is what we need to make treatment decisions. We cannot base our decisions on x-ray alone, because x-ray will underestimate the bone loss. So we need the clinical examination too. So let me walk you through here. On the left side of the screen we have the dental chart. And basically we fill it out with the findings. The reason why we do a dental chart is because we want to remember easily what we found. We want to make some documentation, and we want to make it easier if another veterinarian is going to have a look at this patient after us. And it's just a good idea to keep track of what you found and what you did. And it's easy to just write it on a dental chart. I print those out and I keep it next to me while I examine the patient. I just write it with a ball pen, then I scan it into my journaling system on the computer, and that's it. You can also keep a digital version on an iPad or write on that, so whatever works for you. So the first x-ray I take is always the first quadrant, and with brachycephalic dogs, this can be quite a challenge to interpret and look at dental x-rays. I always say that you can kind of make up your own angles when taking x-rays of brachycephalic dogs, because the teeth are not in their normal anatomical position. They are crowded and they are like rotated and malpositioned. So you have to take several angles in order to see what you're going to see. And oftentimes I rely more on the clinical examination than on the x-ray alone, just because there's so much superimposing of structures, you cannot see it clearly. But let's have a look at this x-ray, and you see here, this is 104, 105 seems to be missing, so we will note that on the dental chart here with a circle. 106 and 7 has some AB, which is abrasion. So, and you can slightly see the discoloration here, the radiolucency. This is some abrasion. So it's been chewing on balls or other inappropriate things. And UCF means uncomplicated crown fracture. So this tooth also has lost some enamel due to a fracture. This is this spot. Oftentimes this is because of the malocclusion, so the lower molars are hitting the upper fourth premolar, causing some attrition or even fractures, and that's why we see so many palatal root fractures in brachycephalic dogs, because of the malocclusion. So the lower molars and premolars are actually hitting here constantly, and eventually it's going to give in and this root is going to fracture. So I see this all the time. The 109 here is missing, and so I note a circle on this tooth. 1010 I write T/NV, means non-vital. This tooth is non-vital. We cannot really see this on the x-ray alone, but I will show you the clinic photo. This is the clinical photo right here, and you can see that this is 1010. It's very discolored. It's brown gray, and this means that the tooth is dead. It has lost its blood supply, and there's only two options: is extraction or root canal therapy. We don't do root canal therapy on these molars, so we have to extract. If we do nothing, there eventually will become a periapical pathology, which can be a granuloma, a cyst, or an abscess. So just monitoring these is not an option. We have to extract this tooth right here. All right, so let's move on to the next x-ray. And you see this is a slightly different angle where we can start to see the roots better. So I've shot this x-ray at an oblique view instead of the lateral, because the teeth, the premolars, are oblique because they are rotated. So they seem fine. We look at the periapical areas here and we don't see any lucencies at the moment. Then on the dental chart, I noted that 102 is non-vital also. 102 is this tooth. It doesn't look like much. Let's check out the next x-ray. So this x-ray, it looks fine. The way we determine if a tooth is non-vital or not is often by looking at the diameter of the pulp canal. And you see that the diameter of this tooth is not wider than the others, as we would expect. But have a look at this clinical photo here, and you can see that this exact tooth, 102, is discolored. So based on this alone, the discoloration tells us this tooth is actually dead, even though we don't see it on the x-ray. Sometimes when a tooth is dead, if the dog is old, the pulp chamber is still quite narrow because the pulp chamber gets more and more narrow with age. So this means that you cannot readily see it. And sometimes even if you have a non-vital tooth, there will be some deposits of minerals that will decrease the width of the pulp chamber, which makes it even more difficult to interpret it. But just based on the clinical picture alone, you have to extract this tooth. There's no pathology right now, but it will come. Okay, so next side here is 204, and we start to see some bone loss in this area. So you can see some radiolucent area right here at the furcation. So 205 is missing, so I put a circle here, and 206 I put an X because it means I need to extract this tooth. So I have a clinical photo here. You can see this is what it looked like when you did your probing. There's a lot of bleeding and a pocket right here of more than 5 millimeters. So this is definitely an extraction. Let's go back to the x-ray, and what you can see here is that the molars are pretty crowded together, so hard to see what is actually going on at the moment. So let's take another view, and right here you can see again that bone loss, and you can have a better understanding of the periapical areas here. Is there any lesions? No, there's not. This area is still kind of questionable if there's any disease or not. On the dental chart here, I wrote that there is again some fracture on this tooth, and we have to extract 209. And let me see if I have... no, I don't have a picture of 209 right now. Except for this one. So it looks normal on this picture, but let me see. I took another angle here where you didn't even see. You don't see much detail at the moment. But I noted M1. So there's mobility on this tooth, and there's a 6 millimeter pocket distally. So it's moving. There's a 6 millimeter pocket. And based on this and the bleeding that we also found, you have to extract this tooth. All right, so let's move on to the next. So we flip the patient now upside down, and now we will take the mandible. So this is in dorsal recumbency, and here we start with the back molars of the third quadrant, so left side. And this is some severe pathology right here. You see 3010 and 11 has been completely destroyed here by bone loss. You can see all this radiolucent area. You can see the tooth root that is resorbing. And on the dental chart, you can see I noted XX because you have to extract. And let's have a look at what it looked like clinically. This is the tooth. So you can see it's very quite damaged, it's very discolored, and there is pockets. So as soon as I put my dental probe in here, there's a lot of bleeding. And I also noted this area with some possibly attrition from the upper fourth premolar is hitting this tooth right here at this exact spot, causing some attrition. But we look at the tooth right here, 309, and we don't see any periapical pathology. We don't see any bone loss, so we can leave this tooth. But the two others need to be extracted. So here's the next picture is getting some of the premolars, and they look fine, except that we also have some abrasion. You can see this, they seem quite flat here, and so you just note AB abrasion. I did note G2 is gingivitis and some fusion of one of these roots. So let's have a look if we can look at it. Yeah, and the fusion is right here. So you have these two roots here that are kind of fused together, but it's not causing any issues at the moment. We don't see any periapical lucency, we don't see any bone loss here, and I didn't find anything by my clinical examination. So these teeth can stay. Now we look at the canine teeth and the incisors, so the central incisors, and you see that again, that dark area around the roots. This means that there's a lot of bone loss. On the clinical examination, this is what it looks like when you probe the teeth. There's a deep pocket right here, more than 5 millimeters, a lot of bleeding. So these teeth, they have to be extracted. Okay, let's see. And here's another view where you really can see how deep this bone loss goes. And we usually say that if there's more than 50% bone loss, you have to extract these teeth. So definitely they need extraction. So we move on to the fourth quadrant, take the canine tooth in an oblique fashion right here. And we note that the fourth, so the first premolar in the fourth quadrant is also missing. So we put a circle here. And you can see on the dental chart, I wrote non-vital again. So let's have a look at this tooth. So the non-vital tooth would be this one. So it doesn't look like there's a problem on the x-ray, but let's have a look. Can I find it clinically? Yeah, here you go. So this is 407. We know this is 409. Then we count backwards, 408, 407, and it's clearly discolored, right? So we know that more than 9 out of 10 of these teeth with discoloration are dead. So we have to extract or do root canal, but not feasible in this dog to do root canal really. So we'll just go ahead and extract this tooth here. But when you look at the x-ray, you can see it doesn't really look like there's a wider pulp canal or anything, but the discoloration gives it away. So you still have to extract that. Let's move back a little bit more, and you see that 409 and 4010 and 4011. This seems like there is some darkened area here, so there is some bone loss in the furcation area, as well as some widened periodontal ligament space. So as you notice that right here, the periodontal ligament, which is that black line, becomes wider and wider. It's more broad here than down here. So you have some widening of the periodontal ligament, and this resulted in some mobility. You can see on the dental chart, I wrote M1. So there's mobility and 4 millimeter pockets distally and buccally. And a 4 millimeter pocket, this is 1 millimeter longer than it should be. Let's see, do I have an x-ray clinical photo of that? I don't think I have. No. But anyway, this is also this area where you have the contact of the lower molar on the upper fourth premolar, causing a little bit of bone loss, a little bit of, this is 3 to 4 millimeters of pocket. The way we did here is we it wasn't enough to extract the tooth, so we went down and I cleaned it up with some curettes, and we're going to check it out next time. Something to note here is that even though the teeth, these premolars, are rotated, they still maintain a gingival color around them. This means that there's gingiva surrounding the whole tooth, separating them from the next tooth. And this is a very good thing to have when you are a brachycephalic dog with rotated teeth, because as soon as the crowns, they touch each other and there's no bridge of gingiva or color of gingiva between, this means that there will be accumulating plaque and tartar in between the teeth, and they will become mobile and periodontally diseased. But so this is a very, very nice feature to have, this nice gingiva around each tooth right here. And just when you extract teeth, make sure you take a post-op. So this is the post-op x-ray. Before you close, make sure that you use your curette to scrape the root surface right here. Take any calculus and plaque off of the root surface so you get a better reattachment of the gums. You could also put bone graft and a membrane to increase the likelihood of a regeneration of bone in this area. All right, so I hope you liked this walkthrough of an actual patient that I saw in the clinic. And please let me know in the comments, what should I talk about next? What is the top thing you'd like for me to discuss? And what do you need help with? So put in the comments what kind of video I should make the next, and let me know if this was helpful to you. And if you like these kind of walkthrough videos, then just click up here to watch another one right now.